Hi, my name is Andre Leahy. This is my presentation on case management basics and how they improve patient outcomes, how we'll educate healthcare staff to be more involved, and follow up on the effectiveness of this program. First, we want to review how do case managers improve patient outcomes? What's the importance of our project? There's a couple main ways that we'll discuss today: access to care, resources, reduced readmission. So first of all, case managers can help support patients by communicating to them what they have access to. So many patients are new to accessing healthcare in the system, have difficulties navigating insurance, just what is covered and what kind of care they can reach out for assistance with. And case managers are very knowledgeable on these types of topics. They also help reduce readmission by following up with patients post-discharge from a hospital, for example, or post-procedure from an outpatient clinic to make sure that they're still aware of their treatment plan, whether that includes medications or follow-up appointments. This helps to reduce readmission by ensuring that patients are complying with our plans and that their health is addressed most sufficiently. A couple further ways that case managers improve patient outcomes are education and by providing patient-centered care. So case managers can continue patient education with all kinds of things, such as preventative measures, language to access healthcare, by helping understand our medical jargon, and by filling a role that helps communicate with patients between them and their healthcare providers. They're kind of like the middle person that helps the patient access all their other providers that are helping them with their care, knowing which provider to reach out for and when to reach out. They also fill in a role of seeing the patient as a whole person. They're able to communicate on social and cultural and religious needs and pass that on to other providers to ensure that the patient is receiving the most patient-centered care, which also is statistically proven to increase and improve patient outcomes. And finally, just a statistic here that in 2022, a survey showed that 80% of patients that had follow-up questions after a health encounter, with non-white ethnicities being more likely to desire more information. So case managers can help fill this role by following up post-discharge and also by finding the proper resources in the patient's preferred language or even in their own community with various types of healthcare that different communities could practice. So what are we hoping to achieve and how will we achieve it? Our learning objectives include meeting with our case managers, explaining the need for them to other staff, and then training the staff. So our goal is to expand the positive impact of case management within our healthcare system. To do this, we'll first need to meet with the case managers and see what are they seeing in the system, what do they need support from other staff with, and what do they think is working best that we can expand. They might have a specific list of requests that they have to ensure that case management is being performed at the best possible level at our facilities. Next, when we meet with stakeholders, we need their buy-in to help us secure funding or see from their top-down perspective on how we can better implement within our facilities. And finally, with the staff, we need the staff to know what does case management do? What can they help nurses with, for example, with the care of a patient? We need to know our resources so that we know when and how to use them. So how are we going to accomplish these goals? There are a couple various ways we can use discussion forums online, which would allow people to communicate anonymously, which can be better for allowing people to share their true perspectives without fear of any kind of retaliation or reputation changes. Live webinars where we can communicate from wherever someone may be, they can access and join in, and it's still on a live basis and still allows for that back and forth of communication. And finally, we have videos, which we can record even for any of these live webinars, post at a later time online for anyone to access at their convenience. Now, with these lofty goals, we will definitely need resources and support, and they'll come from stakeholders, volunteers, and the government as well. So stakeholders, any that are passionate about the state of case management within our facilities, or anyone that has connections with other individuals and organizations that can support these goals, they'll certainly be of use. We'll definitely need volunteers. Hospitals usually have a great group of volunteers that we can rely on to help, even from anything from setting up chairs at any physical event that we decide to host. And finally, government grants can support us financially by allowing us to hire more staff and rent out facilities and host our sites and things like that that require finances. But when do we think this will be accomplished? So today, we're starting with our presentation. The next things we need to schedule are those meetings with our key groups, our case managers, and our stakeholders. After that, we can finally get all this information together, create our educational materials, and start that training. So we're allowing for a couple months to allow this to happen, get our information together. And over a 6-month period, we'll continue to educate staff and students at medical and nursing schools on the role of case management in patient care. After allowing for time for this information to settle in and be communicated to students and staff, and allowing for time for people to reach out for further resources, then we should circle back and determine how effective our project was. We can do this about 6 months after starting as an initial point for engaging in our effectiveness and making any changes we need before continuing on. The team involved, we have myself, the Chief Informatics Officer, and then I see the structure being broken up into a front and a back end, both needing supervision, front end being more front-facing things like our websites and our physical meetings. And we could also use a secretary to help manage calls, emails, reaching out, organizing a physical paperwork. And on the back end, we'll need the supervisor for setting up all of our meetings, making sure our websites are hosted, not any issues with any of our platforms. And this is where we can use a lot of volunteers. How are we going to recruit people, and what will we do when we have issues? Well, we can certainly reach out to schools where we know we have a huge audience that we can reach out to with any email blast if the institution allows, or physical pamphlets that we can post. We can also create social media platforms that many people engage with already, such as Facebook, Instagram, and help to put our information out in that way. And finally, we can use our health institutions system that's already set up, reach out to our staff internally with links to videos and pamphlets that schedule out of our meetings. To stay in communication with each other, we can create shared sites such as like a Google project or a Teams where we can stay in communication and review back past communication. So how do we figure out what needs to happen next? Well, we'll need to follow up with our case managers to see if they've seen these changes that we were hoping to see with them. So is the staff reaching out to them more often for support with patient care? Are they informed about what our case managers can do for them? Are there students reaching out? Are there people more excited about becoming case managers, or are we seeing any increased traffic? And our case managers will be the first to know and the best to ask about this. For staff, we'll want to probably reach out via email, see if we can have them fill out surveys. Do they have a better understanding of case management? What more do they need to know? And finally, for students, as they often have to complete class evaluations, we can incorporate this within if the institution or professor allows, and we can reach out to them via guest speaking events where we can also do surveys and Q&As. So just to recap, case management is very important to the ability of the healthcare system to provide the best care for patients. It's important that all staff involved in patient care is informed on how to use their resources, which includes case management. As no one healthcare provider can do anything and everything for the patient, we need to know about each other's roles and how we can best support each other.